Surgical aortic wall replacement using a mechanical valve in people younger than 65 years is a very good treatment, especially if the patient has an expected longevity of 25 to 30 years. Mechanical valves, when used, have got a 25 to 30 year longevity, but at the same time they have associated other problems like the valve leaking is higher. The area what we get with a metallic valve is much less compared to that of a transcatheter valve, and in addition, people who receive a mechanical valve have to be on lifelong blood thinners or anticoagulation medicines. So when the patients are on anticoagulation medicines, these patients are prone for bleeding and the complication due to this medicine. That is why we have to clearly decide if the patient will benefit, is a low risk patient, low bleeding risk, then a surgical aortic wall replacement using a mechanical valve is very good. And the advantage of a transcatheter aortic wall replacement is it helps in a early recovery, very suitable for elderly patients, patients who have got associated problems like renal failure, associated heart vessel problems, and associated low pumping function of the heart, and people who have got problems such as the blood vessel blocks in other areas, patients who have got a previous stroke, previous open heart surgery or a previous bypass surgery. All those patients cannot undergo a second surgery because the risk of having a second surgery is much higher. So in that group of patients, it is preferable to do a transcatheter aortic wall replacement. Surgical aortic wall replacement is durable. Transcatheter aortic wall replacement also works for about 10 to 15 years. Because in transcatheter aortic wall replacement we use a tissue valve or a bioprosthetic valve. For example, in a surgery, if we use a bioprosthetic valve or a tissue valve, the difference between transcatheter and surgical valve is not so much. Both are equal. But when we compare a mechanical valve in a young person, it is very good. In an elderly person, a bioprosthetic valve using a transcatheter aortic valve is the preferred option for treating this patient.